36 letters with questions to be had. You can imagine if we were to do all 36 questions this evening, that might take a little while. So together, we arranged to have the questions grouped in under a heading, and we'll deal with them under those headings. We'll start off with...
Years ago, I was chosen by many of you and many residents to become MP for Harlow and the surrounding villages. And since being elected in 2010, I've made it my mission to put Harlow on the map. I've campaigned to cut fuel prices, curtail hospital parking charges, championed jobs and apprenticeships, fought for free school meals for disadvantaged college students. I worked for 2 years to bring the University Technical School just opposite at Harlow College. I've stood up against government when I've needed to. I've stood up against local authorities when I've needed to, whether it be about illegal encampments or much else besides. I love Harlow. I'm proud to represent our towns and villages in Parliament. I've championed our community. I've supported our organisations like Food Bank and Pact for Autism. The many Harlow residents who back me are from all political parties, not just my own, from Labour, from UKIP and from others. And this is because whatever people's own views, they know that I have been an MP that works hard for Harlow, that fights hard for Harlow, that champions Harlow. Thank you.
Hi, I don't know anyone. And I'm standing to be the Labour MP here. I'm passionate about becoming the MP here because I'm passionate about fighting for the jobs that Harlow needs. I'm very passionate about taxing bankers' bonuses to provide a guaranteed job for young people in Harlow. I'm passionate about providing the homes that Harlow needs. A Labour government would build 200,000 homes a year if we win. And I'm passionate about defending the NHS, and lots of us know what's going on in the NHS at the moment. I'm not from the Westminster bubble. I think we've got a problem at the moment in politics. Too many career politicians, too many people that haven't done a normal day's work outside of the Westminster bubble. I've spent 10 years working in education, employment and training, working with young people and families. And I'm really excited about bringing to Westminster the voice of Harlow, but also just a normal working voice. Because I think, we need a little bit more of that. I think we've only got a minute, so I just want to end by saying I love the way that this town was designed by Sir Freddie Gibbon. He designed it in a way to bring a good quality of life to people. I live in Harlow, but I'm originally from the East End. The East End wasn't built in a planned way, it's kind of urban sprawl. But Harlow was built in a planned way to bring a good quality of life to people. It was built in a way that people could have access to the countryside. But I think Harlow is not fully realising its potential. It's a fantastic place to live, but it needs investment, it needs regeneration, there's lots of things that it needs. And I want to become the MP here so I can fight for that and I can bring change. Thank you.
Chartered accountant specialising in urban regeneration, so I have been out of work, I'm still working. I have been a Liberal Democrat for 34 years and I've done all the things that Liberal Democrats are particularly known for. At one end, petitioning and getting councils to clear up dog poo, against planning applications, campaigning for children's playgrounds at one level, and at the other level I have a doctorate in corporate social responsibility, and you'll find some of my ideas in Liberal Democrat national policies. I'm very proud of the role that my party has played in the coalition government. We acted responsibly when we learned, and we were to when we took over, that the economy was in a complete mess, left as Labour's legacy. We'll talk about that a little bit later. And please, I've only got a minute. And we acted fairly in moderating what we know would have been the excesses of a Tory government, where the most vulnerable would be suffering. So I'm proud of that one. Tonight you'll hear what we as Lib Dems will do for you in Harlow. But there is one word that I want you to remember in everything that I'm going to say. It's the word prevention. Preventative actions in social, economic, and areas of health and crime, because that is the thing that will actually save the taxpayer money if we can prevent the problems occurring in the first place. So that will be my theme for this evening and the campaign in Harlow. Thank you very much.
Yeah, as you hear, I've got kind of a strange accent. Parents are American. I used to go to an American high school in High Wycombe. lived all my life here, with a few exceptions. Not long. As a truck driver, I know what it is to do a hard day's work, and I know how hard it is to make ends meet. I made my own way through university. I've come a long way since then. I spent the last 5 years working here in Harlow for the people of Harlow, running a small community transport scheme. I've met a lot of you. I know the people here. Every day I help somebody. And that's what I do. I help. I do what I can to make other people's lives better. And that's what UKIP wants to do. We want to try to make your life better. We want to improve the services you get. We want to expand the services that we've got, and we want to protect them. That's what UKIP stands for. And that's what I stand for. It's a little bit over a minute.
I'm Trey, and I'm taught at Mark Hall School for 13 years, more recently in Passport. Taught outside of Harlow before that, for the last 14 years in Harlow. I'm also the local NUT secretary and go around the 95 schools in Harlow and Forest. When I grew up, a fair amount of time ago I guess now, politics seemed to be fairly straightforward. It used to be a choice between Labour and Conservatives. And then along came Margaret Thatcher, and one of the things that she did, and other people have obviously different opinions of Margaret Thatcher, one of the things that she particularly did, which is relevant, is that she managed to move the centre ground of British politics significantly to the right, which has meant that the Labour Party now is fighting with the Conservatives over that same sort of right-of-centre area. I think there's something else. I think there's something more over to the centre and over more to the left that we can fight for. I think we can fight for much more in the way of fairness in society. I think we can fight against the idea of scapegoating immigration. There's much that we can fight for, and that's why I stand for the Green Party. The Green Party obviously is well known for fighting for the environment, that goes without saying, but also the Green Party believes in working for the common good, working for fairness. When we talk about taxation, we're not talking about forcing the wealthy out of the country. We're talking about the wealthy and wealthy corporations paying the appropriate amount of tax. We're talking about people who are living in poverty getting appropriate support. We're looking for a fair society, and we're campaigning for the common good, which I hope is something I can do if elected from Harlow.
The two key issues will be dominating... Eddie, do you want the microphone? There'll be two key issues dominating this next Parliament, and these two issues affect all other issues, such as the National Health Service, housing, education and transport, energy policy, or immigration. The first is the European Union and our continued membership of it, and like UKIP, I strongly believe that we should leave. And the secondly is the internal matter of the Union and the Scottish issue. This will dominate British politics, probably over the next 5 years. The matter's been shamefully left unresolved by the main parties since last year's referendum. And that's caused the rise of the SNP, where they're likely to hold, or there's a very good chance they're going to be holding the balance of power in Westminster and dominating politics and interfering in English affairs at Westminster. And this is going to probably cause a lot of constitutional problems over the next 5 years, if it lasts 5 years. The main parties don't want to address this issue in setting up an English Parliament, and so there will be inequality between the different parts of the United Kingdom. They're scared of addressing the problem of the English identity. That's what the English Democrats are here for. We're English. I think the English are the most gifted people in the world, and we should be given our voice.
Standing as a tough candidate, we're a new party. We've been around 5 years, and we're growing in strength. We have standing 60 MPs now up and down the country. We've come from nothing, and we're growing and growing. I was born in Harlow. I worked for the now extinct youth services that are in Harlow. I'm here just to say no to all cuts, and we shouldn't pay for a crisis we didn't cause. That's basically it. Thank you.
Accident and emergency waiting times are growing. Cancer patients are being put on general wards without proper palliative care, and mental health is underfunded. What are you and your party going to do to reverse this situation and save the NHS?
Brilliant question. The main problem that we have with the NHS is that it is being privatised bit by bit, stealth privatisation. We say absolutely no to any further privatisation of the NHS. It is to no one's benefit, apart from a few people who are going to make a lot of money out of it, including people who are currently in the Conservative Party. We also believe in rolling back the privatisation that's already in place. It's already taken currently and previously in place. Obviously, this needs to be properly funded. The NHS needs significantly more funding, which is why we need to look at tax very, very seriously. More money needs to be raised, and primarily that money has to be raised from the people who can most afford it, those people who are on excessive salaries, in excess of £150,000 a year, that the current government actually cut their tax, going down from 50% to 45%, absolutely outrageously. So we believe in having a look at the changes that this government also made to the NHS, which have not gone down well at all. Those need to be revised. We need to be looking at investing sensibly in the NHS. That's all I'm going to say at the moment, actually, because I think at the moment we're suffering with an NHS which seems more concerned in making money for big business, obviously.
Yes, and actually I wouldn't be here today if it wasn't for Great Ormond Street Hospital, where I used to go as a child week after week and operation after operation. And I would never support any kind of charges to the National Health Service or what has been described as privatisation of the National Health Service. Now let me knock something straight on the head here, and it's very important. Labour and the Greens, and no doubt the trade union socialist candidate, go on about privatisation of the NHS. Let's look at the truth. The amount of NHS that was privatised under the last government was 5%. 5%. The amount that is privatised now, or is not, or is under community, other voluntary organisations, is 6%. 6%. It's gone up by 1%. It's gone up by 1%. That is the truth. So the idea that we are privatising the National Health Service is just a myth and a scare story put out to frighten people, and I'm absolutely ashamed that people want to weaponise the NHS in this way. Spending by nearly £13 billion. There are 9,000 more consultants and doctors, 7,000 more nurses. There was nearly £2 billion spent on a cancer drugs fund. We have ended mixed sex wards. We've decreased massively the problems of the MRSA. And I remember speaking at Church Hustings in previous elections where MRSA came up. We are going to offer 7-day GP hospital appointments. Now, of course there are problems. I don't deny that. I regularly go to the hospital. I speak with hospital staff. I speak with the chief executive. Harlow has some specific problems. We have the highest use of A&E in proportion to the beds than anywhere else in the country. And we have huge problems with A&E, but they have been turning around since January. And by the way, one of the reasons for those problems is because the last Labour government signed contracts with doctors which said that they didn't have to work on weekends. So, and we are also experiencing an ageing population. The medicines, the technology has improved vastly, but is incredibly expensive. The government have said that they're going to increase the NHS spending in real terms. It's one of the few departments that was protected. They've said that they would accept the £8 billion that's proposed by the head of NHS England. But I can tell you, every single one of you in this room, that even if you throw 20 billion at it, 30 billion at it, because of the problems we face as an ageing population and the price of medicine and other issues, we are always going to have some sort of problems. But to say that we are privatising the NHS is a complete myth. And the final thing I'll say about that is that Labour Party signed private finance deals worth 11.5 billion with a whole load of multinational companies that will cost the taxpayer up to 65 billion. One of the reasons that we have high hospital car parking charges is because of those PFI deals. It's something I've campaigned very hard to try and get rid of, and at least the government have said they're trying to curtail hospital car parking charges. So let's get real here, let's be fair, let's acknowledge there are problems, but let's not peddle myths and lies, and let's not weaponise the NHS.
We've had closures to A&E and maternity wards and costly restructuring, which basically is a cover for staff cuts. In spite of this, the private sector does really well out of the NHS. The private finance initiatives that we talk about cost the taxpayers billions in pounds, and these profits go to the banks and private equity firms and the like. The drug companies make huge profits, and the Social Care Act that came in allows GPs to basically tender out to the cheapest bidder, necessary services for mental health patients, the older care. This has all gone up for grabs now. What we say is we need a joined up healthcare now, and we need free dental care, the abolition of prescription charges, scrap the PFI debt. We're the only people that say scrap the debt, don't we're not paying this debt.
I'm extremely passionate about the NHS, and I'm not going to speak today from Labour Party briefing, okay? I'm going to talk today from what I've heard from doctors and nurses, okay? Because you can't argue with doctors and nurses. As someone that works in a school, okay, I work in a school because I care about the kids I work with. There's a nurse at the back there, there's possibly others in the room, there's a nurse there. Nurses and doctors work in the NHS because they care about their patients. So I'm going to take my briefing from them. And this is what they're saying to me. GP, okay, telling me, it's the worst the NHS has ever been. A GP has been a GP for 30 years. A cancer doctor at PAH called me up on my personal mobile, found my number, called me up and said, Susie, under a Labour government I had support staff so I could diagnose people's tests quickly. Under David Cameron they've all been cut. Okay, so this is a cancer doctor from PAH. Okay, now for me, okay, I'm not interested in weaponising or making this a political issue. The NHS is too important for that. It's about life or death. Okay, don't know what someone just hollered over there. Hopefully, it's in agreement with what I'm saying. First of all, if we win in 4 weeks' time, we're going to appeal the bill that Robert Halfon voted through. Okay, no nurse or doctor asked for the NHS to be reorganised, and they wasted £3 billion reorganising the NHS. So when we talk about, we haven't got the money, well, you have the money to reorganise it, which no one asked for. So first of all, we're going to appeal that bill. Second of all, we're going to reverse any kind of privatisation. We are going to invest in the NHS. We're going to invest an extra £2 billion. Now, the question that I know you guys want to ask me is, how are you going to pay for that? Now, just so you know, every single Labour policy I talk about tonight has been fully costed. Okay, we're not going to borrow. Every single one of them has been fully costed. And if you want to come up to me afterwards, I'll give you a copy of one of our little reports that shows you exactly how we're going to cost each one of our policies. So for the NHS, we're going to tax people that own £2 and £3 million mansion homes. Okay? Now, I have not got a problem taxing the very, very wealthiest in this society to invest in our NHS, number one. Number two, the single biggest killer of preventable death in this country is smoking. So we're going to tax big tobacco companies. And again, I'll be baffled if anyone in this room is against that. We're going to tax big tobacco companies and use that money to invest in the NHS. The third thing we're going to do is we're going to clamp down on tax evasion. So we're going to use that money to invest an extra £2 billion in the NHS. And that's going to be 20,000 more nurses, 8,000 more doctors, 5,000 more care workers. I don't think that's going to solve the problems in the NHS, I'm going to be honest with you, but it's a start, okay? And, if you have a Tory government, we've already seen what a Tory government has meant for our NHS. There is a reason why the NHS has been on our TV screens. We need to wake up, guys. It's been all over the BBC. There is a crisis going on in the NHS, and it's not caused because of elderly people, and it's not caused because of immigration. It's caused because this Tory government has not invested in the NHS. And for me, I'm sorry, but I find that unforgivable. I will not be shouted down. I find that unforgivable.
Why didn't you take the internal market
And the
like
final
you
thing-
promised in your 1997 manifesto?
David, I chat to you.
Why didn't you extend it?
Scottish myself, we're not against the Scots, so I'm facing today. The Canny Scots they don't pay car parking charges in their hospitals, which is effectively a tax on being ill. They don't pay subscription charges either, because they've got a parliament where they can make their own decisions of that nature. I just noticed that Labour's policy, the first thing they're going to do is actually reorganise again, isn't it? That's what she said. The first thing they're going to do is come in and reorganise again. They're going to reorganise again. That's a good policy, isn't it? Now the health service is finely balanced. The money we have coming in is a finely balanced thing because it costs an awful lot of money, as has been pointed out. But what did Labour do when they got in power? They brought in 3 million more people, roughly, during their tenure of office. Now that might just put a bit more strain on our health service. 3 million more people. I don't think they're all nurses and doctors, were they? I don't think very many of them were nurses and doctors. And the nurses and doctors that we did take, a very large number of them, we actually effectively stole from countries that are a lot worse off than we are. So there's nothing to be proud about. Our health service stealing doctors and nurses from less developed countries, because that's effectively what our health service has been doing. We need to have a health service that trains our own people as doctors and nurses. I'm sure she did very well. So that's it. We need to have a health service that trains our own people, that doesn't steal from the rest of the world. And we must have a country where our health service is for our people and not for the rest of the world. We must put an end to health tourism. It's going to cost a lot of money no matter what. We must marshal our resources for our own people's benefit and only our own people's benefit.
Comment about privatisation. I just want to remind you that private contracting pervades right throughout all of our health services. So I'm not quite sure what everybody means here by privatisation. Contractors build hospitals, whether they're BFI or any other contracting with pharmacists are private, drug companies are private. You can't nationalise them all. Of course you can. Well, you can't. Well, I want to deal with it. Because you have to own the whole country. But it's up like a bloody communist, rich, too rich. You want to go to Russia? Do you want to go to Russia? And we want it fair and balanced. And that does mean that if part of our NHS is our services are given by private companies, but we get the service we need, we shouldn't be bothered. Now,
No, that means taxpayers
first of
money
all,
goes to the private.
there's a particular aspect of this that I want to do with, which is mental health. But just let me say the Lib Dems had promised the £8 billion put into the... Well, we have funded it.
You promised it.
We have a funding mechanism, which we've shown again, like Susan, if you want to see the calculation. It is partly based on taxing the non-dom companies that have infested this country, the Googles, the Starbucks, who do not pay their taxes, had cosy chats with HMRC, and we know that the royalties, management charges, transfer pricing can all be dealt with, and if they don't agree with our calculations, we'll impute turnover or charges, so that we will get taxing them. If they don't want to be here, they can go. So,
Run by Circle, correct?
Not anymore, mate.
Not anymore. Why? Because they threw it back. Common sense says hospitals cannot be run efficiently by private companies. Can anybody disagree with that?
Yes.
You can. Okay, great. You can.
Of course you can. Look at Bupa. They make profit.
We cannot privatize our services. It is common sense. But we have split up our NHS and we turned it into trusts. And many of these trusts, their chief executive officers are making more than our Prime Minister. Can anybody see something wrong with that? I can. Okay. PFIs, private financing initiatives, we can top on this one. The interest that we are paying on those loans could go a long way to paying off a lot of the deficit in the NHS. Is this not common sense? Evidently not. Has anybody talked about the TIP agreement that's going on and trying to make sure that the NHS is not going to be part of that? Because while we are not able to stand up for ourselves, agreements can be made through Europe which require the NHS to privatize itself. We have a system of management where if a manager fails miserably in one location, you tell them I'll go somewhere else and be hired as a manager. If a doctor is charged with malpractice, a physiotherapist, a nurse, they are struck off. Management, when they foul up as bad as some of these people have, should not be allowed to continue as managers in the NHS. But we allow it. And it is consistent. UKIP would like to see more training, on-job training for nurses, midwives, and all staff. They want to bring investment into it. Okay? Everybody's throwing in a figure. I'm not even bothered with the figure. Okay? I'm going to try and say that we need qualified people, educate them well, from this country or from elsewhere. I don't mind. We need to protect it. We need to ensure that it stays part of the nation. And we are losing it, ladies and gentlemen. And UKIP, through common sense, not left-wing, right-wing, or anything else, is saying that the best way, the most efficient way, the best British way of running the NHS is to keep it as the national